The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host Kimberly Brumell, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' miraculous recovery stories. Today, we'll have a Skype interview with Mike Cayley, Senior Vice President of Lockton Dunning Benefits, to hopefully answer some of the questions you have concerning the Unaffordable Health Care Act, better known as Obamacare. We'll also hear from our Help from Wounded Warriors patients that have received complimentary and exclusive Bonati spine procedures from world-renowned surgeon and founder of the Bonati Spine Institute, Dr. Alfred Bonati. We will hear about their remarkable recovery from them personally and the medical staff that assist Dr. Bonati in treating these patients in our Back to Life segment. We are also very fortunate to have Florida Congressman David Jolly join us at the News Radio 970 WFLA studios for a simulcast of this TV program and our radio program, American Medicine Today, which can be heard Saturdays at noon. Congressman Jolly is very concerned about the crisis facing our veterans and the problems in their medical care. Finally, we'll hear from Dr. Bonati about how he feels our government needs to react to the inadequate care facing our veterans and what we all can do to help our wounded warriors. Joining us back from New York City and introducing our first guest is our radio and TV program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thank you, Kimberly. Pleasure to be back. Now, every Saturday at noon, we typically feature a guest that'll shed light on the growing concerns many Americans have about their medical care. The Unaffordable Health Care Act, or Obamacare, as we like to call it, is something we take head on, but not with any political agenda. We just want to bring light to this crisis in American medicine today.
Mike Cayley is the Senior Vice President of Lockton Dunning Benefits, the world's largest privately owned insurance brokerage firm.
Mike has extensive knowledge of the Affordable Health Care Act and can hopefully answer some of your questions.
Now, Mike, what are some of the inadequacies that you see currently with Obamacare?
Well, thanks for having me on today. I think there are several things that are inadequacies built within the program. The first of which is that it may not be affordable for anybody at all. When you look at the changes that have happened to the private marketplace and the inadequacies of the public health exchange rollout, it hasn't seemed to work well for anyone. And the way that it's structured really increases the cost for everyone. There's nothing, as a matter of fact, very limited things have been done to actually control any of the costs associated with healthcare.
Very true. And I'm not sure that it's still even reaching the people that needed it. I think they've taken from the people that had insurance and then they put them in the pile now for Obamacare, but I don't think they've reached out to that group that they said they were making Obamacare for.
Certainly, we've spent a lot of money as a country creating additional 8 million people on the public exchange, which seems like a whole lot of resources expended for very little resource or result. And what happens here is that by expanding Medicaid, we've transitioned a lot of additional folks into that system, which creates liabilities for the states. And from an individual perspective, we haven't lowered the cost of health care. We've simply said, for those that are making less than 400% of the poverty level, that we're, as a federal government, going to pay a portion of your premium for you. So we've created a disjoint between who's actually using the service and who's paying the cost.
Correct. And the subsidies get passed on to the rest of the citizens, do they not?
Subsidies get passed on for people that don't have an offer of qualifying or affordable coverage from their employer.
Okay.
And make below 400% of the poverty level. And so there have been a lot of reports recently that upwards of 3 million people may be receiving subsidies incorrectly because the federal government can't actually verify their citizenship, their immigration status, or the income requirements necessary to receive the subsidies they're already getting.
Have you seen, I don't know if you have access to this, but have you seen an influx of Medicaid recipients?
Absolutely. The Medicaid rolls have expanded tremendously in places like Texas or Florida, as an example. You haven't seen an extension of Medicaid, and so those rolls have not expanded, but traditional blue states, Illinois, California, Washington, Oregon, Vermont, New Hampshire, places like that, where they have extended Medicaid, that's where a large percentage of the newly covered individuals have actually found their home.
Right. Have you seen companies' insurance being canceled because of the new legislation that's built into Obamacare?
We modeled health insurance expenses under health reform for about 700 employers over the last 3 years, particularly in retail, hospitality, restaurants that have a significant impact as it relates to health reform. And almost all the time, it's the wrong decision to do away with health insurance altogether. It will be the most expensive way for these folks to do it. Right. And it ignores the fact that we need quality employees and we want to treat our employees well as a way to deliver the right service to people. American industry falls apart. So I think employers are trying to find the right balance between being fiscally responsible and the general paternalistic view that most take.
Do you feel that Obamacare is going to affect the quality of care that they should be receiving?
I don't think you have to look very far relative to recent news events to determine how government applies health care. You looked at the VA, you looked at Medicaid or Medicare in some cases, and the types of efficiencies that they might interject into the system. I think ultimately what it comes down to is having a comfortable relationship with a physician, having access to the means to be able to pay for that reasonable and quality consultation, and the mechanism we use in order to generate that is what will help us to solve this healthcare crisis in America. We don't necessarily, in my opinion, need the government to tell us exactly what we need to cover, how we need to do it, when we need to accomplish it, and penalize us for private purchasing decisions.
Okay, well, thank you very much for your time. We certainly appreciate you being here. I'm Mike Cahy. Thank you.
Thanks a lot.
Please join us on News Radio 970 WFLA Saturdays at noon to hear more from Mike Cayley and other politicians and experts about the crisis in American medicine today. Now, Kimberly, some of our viewers have inquired about why Dr. Bonati chooses to air his political opinion in a public forum.
Well, Dr. Bonati believes it's his duty to help protect and preserve the medical rights we have in this country. Please understand, Dr. Bonati is first and foremost a highly skilled surgeon that is truly passionate about helping his patients that have suffered or are currently suffering with back, neck, and sciatic pain for many years.
We'll be right back to hear from a Bonati spine procedure recipient benefiting from our charitable Help for Wounded Warriors program and our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.